Good evening and welcome to the 5th episode of this season of The Aesthetics Show, where we talk about everything aesthetics every single week. My name is Dr. Marcus Mehta and I'm joined by my co-host down in London, Dr. Tristan Mehta. Both of us are from Harley Academy, the UK's largest aesthetic medicine training provider. We are live here on YouTube tonight and we will be for the next 3 weeks, every Tuesday at 7 PM until the 22nd of December. As we are live, please feel free to ask any questions you wish as we go along in the chat box and we'll answer them as we go through. If you haven't already, please subscribe to our channel down here and you will get updates when the show goes out and see exclusive content we produce from the Academy and the show itself. Now, this whole season is around success in aesthetics. We'll be meeting some key figureheads in the industry. We'll find out a bit more about their personal stories of how they got to where they are today. Now, I'm very excited this week as we have the much-loved Natalie Haswell on the show from Haswell Aesthetics to share with us her journey from nurse to successful aesthetics practitioner, trainer, and a brand new clinic owner. I'm really looking forward to having Natalie on the show as her journey, I think, will really resonate with many of you watching and hopefully help you out on the many challenges that it is to become a successful practitioner in this industry. Next up will be our treatment section, and finally we are back with a live injection. Tris will be treating our patient Zara down in our London studio and we'll be walking you guys at home through a beautification and a lower face treatment. Now, if you haven't already, as I said, please click subscribe down here in the bottom of the screen and let's get going with tonight's show. So let's bring in Tris from London. Let's get him up on the screen here. How are we doing tonight, Tris?
I'm feeling very festive, Marcus. I've had Michael Bublé on.
Perfect.
Been doing some decorating and yeah, I'm ready for Christmas.
How's the clinic been in London? Has it been busy?
Yeah, great. Great first day back actually. Plenty of training, and I think we're seeing, generally across our clinic and from people that I've been speaking to, a healthy bounce back to normal business with particularly our injectables business.
Yeah, absolutely. I would agree. I mean, even here we're the same. It's been really busy and we're pretty much fully booked now till Christmas, which is great. It's great to see, considering we've all been shut for so long, that people are still keen to pursue aesthetic treatment. So that's great. So we've got a really busy show tonight, Tris. So I thought let's jump straight into the news section and then let's go in with the live injection later on this evening even. So first up, news. The first thing is we're obviously all back in clinic. And I found a really interesting study that Hamilton Fraser did on statistics in aesthetics post-lockdown. So I'll share them with you now, Tris, and see what you think of these. So first is that since restrictions have ended, 82% of aesthetic practices have reopened their clinics. However, 88% said that they were still working for the NHS. As a result of lockdown, they've carried on working there. So what does that mean for aesthetics, really? Because that's quite a large percentage of people that are still carrying on with their previous day job, I guess.
I mean, there's a few things to think about there. The Hamilton Fraser practitioner is very broad spread, so probably early years practitioners, but also definitely the more established clinicians as well. And I think perhaps you could say that there is definitely a demand for clinicians to return back to the NHS, and maybe practitioners are wanting to continue that, which I think is great. There might be a renewed focus on how they want to spend their career, and maybe they're compelled to do more work within their prior roles. Maybe it's a security thing to keep a steady income during a fairly uncertain time. They're quite high percentages I mean, it would be good to know of those clinicians, how many of them were in full-time aesthetics beforehand. But it doesn't surprise me that the majority of practitioners are splitting their workload between their NHS work and their new aesthetics business.
I think, probably a large part of that, as you mentioned there, is risk, isn't it? It's balancing risk, because it was a very difficult time. And I think another stat that they mentioned was that people didn't have a contingency plan. They had no idea what to do. It's not something, as a training school, we never teach people to deal with shutting your clinics as a government lockdown, right? So it's completely a new realm for people, and I suppose probably quite worrying. And, it was bad for us in a sense, because we've got, a clinic and we had to shut, but at least you're not in that first 6 months of setting up and establishing yourself, because that would have been really, really difficult. And so I kind of understand why people probably still kept their other line of work. But, hopefully with everything going forward and this vaccine that we're promised soon, we should all be getting a little better. The other thing I found in this data as well, Tris, when you have a look through, is that it said 11% of these people they analysed found that they were treating increasing number of younger patients. So 11% of that population had more young patients in their clinic doors than they did prior to lockdown. And we've mentioned before on the show, and I'm sure many of our listeners and watchers have seen before, about this idea of the Zoom face, or a change in people's perceptions of what they look like, mainly because they're staring at themselves on a webcam every day. Is this something you've seen in clinic? Have you noticed a different demographic or a different patient's been through the door? Even I know we've had our second lockdown, but in the gap between the first and the second.
It's not something I can say I've seen myself, but I think what I'm particularly interested in is, obviously, over the last year, a lot of practitioners have had a lot of time on their hands, and they've decided that they're going to spend their time focusing on their marketing and getting their name out, which is what they should be doing. And so there's been an enormous amount of marketing coming from practitioners out there, particularly on social. Now, I wonder if that may have reached even deeper into that younger demographic, and that could be a factor for why we're seeing more younger patients. I think we really don't know the impact of COVID and more live video calls and more focus on our phones, for example. It will be very interesting to see the impact that has had on the demographics that are choosing to come to clinics more or less. And I think we'll only get a picture of that probably once things return to what we could say as a baseline, maybe in a year or so.
Yeah, when things settle out, absolutely. I completely agree with all that. Well, in regards to news and stuff tonight, I really wanted to focus on the excitement that we've got our new injection starting again, and you're going to be treating obviously Zara this evening, and more of the juicy parts of the show. So let's get going with it. So really excited tonight to have Natalie Haspel with us from Haspel Aesthetics. So let's bring Nat right now onto the show. Hey Nat, how are you doing?
I'm good, thank you. How are you, Marcus?
Yeah, really good. Thanks so much for joining us tonight on the show to talk all about success. So to start with, I think it would be really nice for our audience just to get a bit of background on your journey. So let's start from the beginning. Where did you start, and what are your steps that's got you to where you are today?
So I came into aesthetics in 2017 after 18 years in the NHS, including my nurse training. And I'd worked in quite a few places. I'd worked in a hospital, I'd worked in primary care, I'd worked in general practice. And I just got to the point where I thought, this is fantastic, but I can't do this for another 20 years. The budget's not there. The patient satisfaction is being outweighed by the stress.
Yeah.
I need to do something different, but I've got all this experience, so what can I do with it? I didn't just want to leave nursing altogether.
No.
And then someone mentioned aesthetics, and I thought, I'll go on a one-day course, because that's what I heard you did.
Yeah, that was a start, yeah.
And I'll see what it's like, yeah. And how wrong was I? Because when I got on that one-day course, I realised that one day wasn't going to be enough.
Yeah. And did you know that straight away? Did you know that, like when you finished the day, how did you feel?
I felt amazing. I absolutely loved it. I was so fortunate. On my day, I met Lorraine, who now works with me as well in clinical practice. It's amazing. And we've stayed friends ever since. And she worked as a matron in London, and I was working as a matron, so it was really nice. And we just felt so inspired, and we hadn't felt like that in a long time.
Yeah.
And yeah, it just felt fantastic. We just felt excited, and it was something really different that we could use all of our skills in. So yeah. And
I think that's it, isn't it? Because when you've been doing your job for a long time in the NHS, and you get quite used to it, and to be fair, you get quite good at it because you know what you're doing and you know your limitations and what you can and can't do. And then and then when you move to aesthetics, it's a whole new challenge as well, isn't it? There's that new element of excitement and new things to learn and new things to do. Yeah. So I think that's, I can completely understand where you're coming from. So what happened after you did that then? Where did you go with your career? What happened after your one day, and where did that lead to?
So I'd already looked into doing the level 7 because I'm very much the level that I'd got to in nursing. I thought you can't specialise in anything, even in the NHS at the level that I was at on a one-day course. Yeah. If I'd gone in to be a nurse specialist in any area, it would have been a master's qualification. So I fully came into it thinking I'm not just going to do one day, but I'll do one day and see what I think of it.
Yeah.
And then on the day, I remember saying to Lorraine, this is actually harder than it looks. And she was like, yeah, this is harder than it looks. And I was like, and if you're going to be any good at it, you need to invest a bit more, and you really need to get some good training. And it was after that I came away and I went for dinner with my mum and my auntie in London, and I was like, I need to do this level 7. I want to do it. And I was just so excited. And then I booked onto the level 7.
Yeah, and then three level 7. Obviously, you've done your cases, your observed cases, and supervised cases. Now, did you start your own practice in the background of that, or did you wait till you finished? Because people do different things, right?
Yeah, they do. And I basically started. I did all my e-learning, and then I did my observation cases. With Emily, which were fantastic, and I then thought about setting up my own practice, but my brother has got a business degree, and he was like, you need to think about it. You've got to scope your market. And I was like, I know nothing about business. I'm a nurse. I'm just going to learn my clinical thing. And he was like, no, if you want to do a business, you need to look at your unique selling points. I was like, what are they? I don't even know what they are. And I basically then, so I did my obs days, and I started scoping my market and my local area, building my business, thinking about what I wanted to do, thought about unique selling points, etc., etc. And then after about 6 months, I did my mentor sessions, and then I was like, okay, now I feel a bit more confident. And I felt more competent. I felt like I could actually manage it on my own and just do the kind of the basic treatments. So your 3 areas of toxin, and your few areas of filler. Filler still petrified me though.
Still a scary experience when you're finally by yourself and people are paying money for treatment, right?
And people are like, well, you can call this number and people will help you, but at the same time you're like, well, who are they? And it is very lonely when you're used to being in a team like the NHS, isn't it?
Definitely. And another thing is, so when you started working, I know a little bit about it because you started working in like rented spaces, didn't you? So you'd go into a salon and work there, or work in an environment which was already set up, and then you use that space for a day or something. And I think that is often the way that most people do start. Is how I started, right? It was in an osteopath, and you rent a back room and you kind of work from there. How did you know how much were you going to pay for that day, or how was it going to work with commission rates? Because that's always quite a difficult subject, I think, to navigate.
Definitely, and especially as being in the healthcare service, like yourself, you're a doctor, and we don't talk about money apart from your salary, which is pretty set, and this is what you're going to get. You're not ever going to get a pay rise. Not used to taking money, talking money, negotiating. Generally aren't business people. So it was a case of I asked other people. I asked on group forums, which were really helpful. I had a look at kind of what other people were doing. When I was on my course, I met other people and we chatted, and we had a little WhatsApp group. And then it was just a case of finding somewhere, which is really hard because, like Trish says, the market isn't saturated. There's a lot of people doing it, not necessarily doing a wonderful job, but it depends on their training and whatnot. But it's hard to find a space, and a space you would like to be in, because that has an impact on your business as well.
Like the kind of people, basically, who you're going to be attracting,
So I started off in one salon, and then a friend of that person who had another salon about 6 miles away said, could I go there? So I was like, yes. And then before I knew it, I was going to 4 different salons, but all around Colchester. So I didn't want to go too far, because I was always really conscious that if something went wrong. So it was all within a 15-mile radius, but they were all 5 miles apart, and that was their condition with them all. And then gradually I thought, I can't keep going to all these places and lugging this bag around. So I cut it back, reduced the clinics, and then it got to the point where I was like, I'm paying a lot of money in rent. Why haven't I got my own clinic yet? And Tristan said to me, he was like, Nat, are you going to get a clinic one day? And I was like, do you know what? I think I'm going to get one now. And then
now's the time.
6 months later, here I am.
Just opened your new place, haven't you?
I absolutely love it. It's fantastic. Everybody said to me when it opened, and then we had to shut for the second lockdown, oh, you must be so disappointed. I was like, no, don't worry about me. I'm fine. I've prepared for that. I'd be silly to have thought it might not happen again. But then after a little while, I was like, actually, I feel quite sad. I've got this clinic and I can't use it, but we're back now. So
We're back now, and I think one of the nice things when you have that, isn't it, is suddenly you've got your own drawers, your own cupboards, you know everything is, you've not got your briefcase, and you're trying to make the room nice every time. Like, I remember when
Yeah,
I started, and I was working the osteopath, and it's like, when I was right at the beginning, I had just like one review on an afternoon, and I've got to get like
yeah,
fully dressed up, like get the
yeah,
incense out, like clear the space. It's like, oh hi, yeah, I've been here all day. I've seen loads of people today. Yeah, just come and have a review. You know what I mean? Actually, it's taking you 2 hours either side of that to actually see this one patient for a review.
yeah.
Yeah, and I feel your pain when it comes to that living out of a bag when you start. Yeah,
Oh, it's just, and I just got to the point where I think there was one time where I fell over and hit my knee, and I was like, seriously, come on, this is supposed to be easier now. Come on.
yeah,
But yeah, it is hard, but it is nice. You're right. Today I've cleared up and I have left the clinic, and I know tomorrow morning when I walk
it's all
in, it's
there.
going to be being clean and it's all there and it's lovely.
Yeah,
So
nice,
nice.
nice. So for our audience, let's talk about your journey. What do you think, if you would say, what's the biggest challenge? So now, if we talk about your journey from the start, what do you think was the biggest challenge, the biggest hurdle that you had to cross to get to where you went to? What was the thing that held you back the most, do you feel?
All of it, every single part of it was a challenge, and it was hard work because I had my training, so clinically I felt competent to
Yeah,
do it and confident, otherwise I wouldn't have started. But the rest of it, finding a space, negotiating rent, taking money, the amount of people that
yeah,
even now, someone today walked out and hadn't paid. And Holly said to me, did she pay? No, I forgot. Because for all these years, I've had a job where, are you happy? Yes. Okay, bye. And you're just
that's
pleased
it.
in the NHS that someone's happy,
Yeah,
and they're well and they're going home.
yeah,
So, yes, the business side of things, definitely really hard. Marketing yourself. But then
mm,
you start and you get carried away. Because if you don't sell yourself, no one else is going to do it.
no,
But a lot of students where I teach, they say to me, well, I haven't got any unique selling points. I'm like, aren't you an anaesthetist with 15 years experience?
yeah,
Yeah. Okay, selling point number
that's a
one.
big
Like,
one.
you're putting me with confidence already. And just explaining that to the public, because a lot of them don't even know what that is or what that means.
No,
Um,
absolutely.
so, yeah, so definitely the business side of things.
Yeah,
Um, the practical side of things, I don't feel like I've really struggled with, but I invested in good training and I invested in a lot of master classes, and I think that made all the difference. I wasn't trying to watch
mm,
loads of YouTube videos to get the information that I
yeah,
needed. I paid for specific training, and that investment does make a difference.
definitely helps. Yeah. Well, that's great. Well, I think what we'll do now, let's jump Tristan on the chat as well. I think he's got a couple of questions for you.
Yeah, sure, Nat. Congratulations on your clinic launch. That's wonderful. Very pleased you got there. What's it like being idolised by all the Harley Academy trainees that ever come to our school?
I didn't know that was a thing.
It is a thing.
Yeah,
I don't know how to answer that. No,
that's all
I
right.
just
You don't
need
have to
them
answer.
all to love it like I do and enjoy it like I do, because it is so nice. I love my job.
Yeah, I think that's very clear. When I'm working with you is that you do things properly, in the way that you know when it comes to PPE, Nat will do PPE better than anyone in the building.
Yeah.
And I think we're in a world where shortcuts exist and people can take the easy road, at the expense of often patient safety. And we get a lot of new practitioners coming through our courses, and on our open evenings we get questions about how long should I have spent in the NHS before I go into aesthetics, and what's the minimum I need to do to be able to practice. So now I just want to get your advice. If someone's watching this and they're considering going into aesthetics, or they're considering how they should set what the mindset they need to have to be successful like you, what would be the advice that you would give them?
That's a really tricky question, because everybody is so different, aren't they? And I personally used to think the more NHS experience you have got, or the more senior you are in the NHS with more qualifications like you're prescribing, the better it is. But then there's not, there are some people that are very experienced, very well qualified, that do take shortcuts, unfortunately. And then I've met other nurses, dentists, doctors that have been qualified 2 or 3 years, and they're absolutely fantastic. clinically they're amazing, like Chantel. They're a great injector. They've got really good experience, and that makes a difference. And that's why I would offer to prescribe or support somebody like that, because I think sometimes people that don't have as much experience aren't seen as highly regarded. But that said, it's very different. People like people, don't they? Chantel, sort of patients. Some people like people because they've got a lot of experience, but then a lot of experience doesn't always mean you're very good.
That's very true. You could do the wrong thing for 10 years and you'd be rubbish, wouldn't you?
Exactly. So I think, ideally, I say sort of a good 5 years. I think to be in the NHS, and a lot of people think, well, what does that bring to my aesthetic skills? But it brings people management, it brings complication management, conflict management, because you deal with that all day in the NHS, and I think
of course,
it is important.
Yeah.
It is definitely important. I do sometimes, when we have nurses that have come straight from their nurse training, straight into aesthetics, always say to them, please try and get at least 6 months, months, in the hope that they will do more, because they are so valuable.
Amazing. Well, now, best of luck for the new clinic. We're going to have you on again and see how you're getting on. And surely you'll be expanding to your next clinic in another location sometime soon, I hope.
Because now I'm going to go, oh, where could I have another one?
Yeah, exactly. Well, maybe next time we can do a live tour. We're going to do a live tour of your clinic on the show here.
My children are like cringing right now.
All right, well, it's been brilliant to have you on the show, Nat. Thanks so much for coming on, taking the time to share your journey with our audience, and we look forward to speaking to you soon.
Perfect.
Thanks, Nat. See you soon.
Bye.
So brilliant to have Nat on the show this evening. If you've got any questions for Nat about her journey or how she's got to where she's got to, feel free to drop us a message. We will be doing an after show feature this week where you can jump over to our Instagram after the show, and on our stories you can ask any questions you wish about the show, and we answer them throughout the week before next week's show. So next up, really excited to be back with our live injecting. So I'm going to be handing over to Tris down in London to open up the next section.
Thanks very much, Marcus. Great to be back. And so, yeah, we're here live at the Harley Academy studio in Moorgate. And I'm very lucky to be joined this evening by our patient, Zara. Welcome, Zara. So what we're going to start off by doing is an assessment. So if we can get a zoom in on Zara's face, and if you could sit forwards, please, Zara. And then let's talk through a little bit about Zara's history and the treatment plan that we've got arranged for this evening. So Zara is 26. And very interesting ethnic background, so half Indian, half Italian. And so let's take a look at some of these features that we have. So we can see we've got a lovely symmetrical face, very youthful features, big eyes, and we've got a oval-shaped face. And the thing I want to pay attention to here is a little bit around the jawline. So we can see we've got a very clear defined jawline, and then just towards the front we lose that definition and it sort of flattens off. So one of the first things I start to see when I'm examining the shape of the face is the outline of the jawline and how it transitions towards the mid-face and along the temples and through to the forehead. And you can see in the lower face here, just at the front, if we created a slight more projection in the midline to be in line with the nose, we'll be able to continue that jawline along and really help with a really beautiful beautification treatment that we're planning tonight. So alongside that, just in towards our mid-20s, as we know, we start to lose a little bit of fat in the front of the mid-face here. And we've also got a slight loss of definition over the apex of the cheek. So what I want to show us tonight, Marcus, is a really routine cheekbone treatment and how we do that, which is something that's hopefully going to be really interesting for practitioners more towards the start of their journey. This is something that we should be able to do very confidently and always get great results from. And we're just going to be doing some supraperiosteal boluses at the apex and sweeping backwards along the cheekbone. If you remember last time, we did a cannula in the prezygomatic space. I'm going to show you a needle approach this time with some simple boluses along the cheekbone. So what I want to do is I just want to show the impact that can be had with a simple cheek and chin treatment to affect the shape of the face and the beautification of the young female face. If we've got time tonight, we can see a touch of volume loss in the front of the cheek. If we can zoom in a bit more just there, please. You can see a touch of volume loss here, and you can start to see the under eyes. If you bring your chin down and eyes up, you can start to see a teardrop. And this is a very treatable under eye. So if there's time, we can use some Juvederm Volbella, and we'll treat the under eyes as well. So that's my plan for this evening. We have just got a start to the volume loss periorbitally, and I'm going to leave the lips well alone. Really beautiful features, really beautiful skin. So I think we'll have a nice result today, Marcus.
Yeah, brilliant. Sounds like a great plan. So what products are we starting off with, Tris? Because you say you're starting with the mid-face. What are you going to be using, and what kind of volumes? Because they're the questions we're going to be getting.
So let's do it as we go along. But I'm going to be starting off with some Juvederm Voluma on the cheekbones. If you can rest back, please. And let's start marking this up. So this is something that we talk about a lot here, Marcus. Getting some good markings before we've even started. It's worth mentioning, of course, off screen we have done a full skin prep with makeup wipes and then Clinisept twice. And I'm just drawing the underside and the superior border of the zygomatic bone. So let's be really clear about our landmarks for treating the cheekbone. If we can get a zoom on this frame here, please. Where do we find the apex? I'll tell you my top tip for finding where the apex is. It's simply a vertical line from the lateral orbital margin. And we just want to find a point where we can create maximal projection. And so for me, that's just there. And we've here nicely highlighted the zygomatic bone. Somewhere laterally, we're going to feel for the suture where the temporal bone fuses with the zygomatic bone. And on the suture, we're going to do our point there. And then we're just going to go in front and behind.
So
and
Tris,
these are the 4 points.
Sorry, Tris, well, when we talk about marking up and the suture particularly, is there a reason you treat onto the suture to get a better result, or is it more of a landmark you use because it's a good place usually in the face?
Yeah, we're just looking for consistency here, Marcus, and it's something that we can use to teach really comfortably about how to get reproducible cheekbone results. Remember that when we're starting out, anything lateral to the mid-pupillary line is a safer place to treat because we have the facial artery, we have the infraorbital foramen, and so treating on top of bone, supraperiosteally, and with consistent landmarks is just going to start building the confidence for more beginner injectors for their first 10, 20, 30 patients. So we can see she's got quite a broad zygoma here, really kind of shaping and framing the lateral mid-face. And again, so find the lateral orbital margin, vertical line down, and then almost artistically find where you want to get that maximal projection of the zygoma. Always good to test whether you're in the same place on each side. And then again, we're going to find that fusion. If I can get a skull, actually, I want to introduce Emily. She's on the channel tonight.
Hi, Tristan. Skull coming up.
Thanks very much. So if we can take a look here, thank you very much. If we can get a zoom on this, please, Josh. Just where my finger is, you can see here a suture in the bone. And this is the fusion between temporal bone and the zygomatic bone. And so we're just putting a mark there, in front and below, and then, of course, on the apex of the cheek as well. So this is routine, and this is something that we teach all day long in our routine mentoring, but something that is still easy to get wrong unless you spend your time properly marking up. So that's part one, Marcus. And then when we move into the chin, what we want to be doing is looking at the width of the nose. And so I'm simply just going to be drawing the alar width all the way through down to the chin. And then we can define how we want to approach the chin. And we've seen a few different approaches in previous episodes for how we treat the chin, sometimes with a cannula, sometimes with a needle, sometimes to create anterior projection, sometimes inferior projection. in this case here, it's very clear to me, if you chin up a little, just here it's starting to flatten a little. I'm going to mark the underside of the chin here. I'm going to mark the midline of the chin here. And then all I'm going to do is just find my targets either side to help create a little bit more projection in the midline.
Mm. When you're marking the chin out, Tris, and so safety-wise, obviously the midline is essentially quite safe from a vascular point of view, and you're working about, is it about half a centimetre outside of that each side you're looking at?
Yeah, that's right. So, and yeah, all the vessels in the lower face tend to run deep. We've got the facial artery, we've got the labiomental artery, all in beneath the muscle plane, and then actually alongside the underside of the bone, we've got the submental artery that runs along the bone. So you don't generally want to inject on the bone on the underside with a needle because the submental artery is on bone. But on the front, we can do supraperiosteal boluses with a good aspirate, or we can use a cannula. What approach would you recommend we do here, Marcus?
Well, I think we've used a cannula before on the show a few weeks ago, so why don't we use a bolus technique here? It's interesting what you say about the treating the underside, because when you think about, when I always treat chins, I always think about those three angles, you know, Pagonian, Menton, Nathian, when you're treating. So do you never go like vertically from the bottom and touch the mandible kind of on the rim? You don't inject on that point then?
Tristan signalling for me to answer that one, Marcus. I think, yes, you can inject there, but I am more likely to do that with a cannula off the bone. It's actually a lovely place to inject just to create length without projection on the right person. Personally, I wouldn't have my needle on the bone there, though. I'd either lift my needle off the bone, lifting the soft tissues off the bone with my non-injecting hand, or use a cannula.
Okay, yeah, just to fill that little space underneath to try and get that inferior projection almost, and vertical elongation, I guess, is what I'm trying to get at, I think.
Yeah. So, Mark, what I'm going to show you, because I think it's a good episode to focus on, is how we hold our syringe and the two ways in which we can hold it and perform an aspirate. So we'll start on the patient's right, and we'll start on the apex. I'm just going to start with 0.2 on the apex. And the first technique I recommend that we start to learn with is with our non-dominant hand, we will squeeze the tissue, sharp little scratch, not through the white dot, but just by the white dot. Touch down on the periosteum, then stabilize with your non-dominant hand. And don't move the needle, of course, but with your right hand, you can then aspirate for a good 5 seconds. And it's very, very stable. I can slowly inject 0.2.
And this is Voluma we're using here, I guess, by the looks of that syringe.
Yep. And it's comfortable, and it's a safe way to hold the needle and get a good aspirate at the same time. The second way, if you want to be a little bit more fluid with your movements, you can hold the syringe with your dominant hand, like this, and then with your one of your other fingers, you can aspirate, like this, and then with your non-dominant hand again, you can squeeze, touch down onto periosteum, and then you can do a one-handed aspirate like this, and then inject with your palm or the base of your thumb. And when you get a bit more confident like that, you can then be a bit more fluid with your sequence of treatments if you're doing multiple along the cheekbone, for example.
Mm. And you know at all times your needle's grounded, basically, when you're doing these, don't you?
Yes.
Really exciting, actually, about aspiration. In a show upcoming, we're going to be talking about a new little gadget, actually, that's come out of Miami called the Lifty, which is a new way of aspirating, which we're going to try out here live on the show. They've sent us some samples, actually. So that'll be good to try, Tris, on one of our live shows, too.
Yeah, you've been talking about the Lifty for many weeks now.
I know I have. I'm quite excited about it, actually.
Marcus.
I didn't catch that, Tris. What did you say?
I was just talking about what you want in your Christmas stocking for this year.
A load of Lifties, yeah.
Right, so we'll just move on to the other side. And here we're going to change the needle. because we've touched the bone a few times now, so we're just going to switch around.
So can we see it from the front, Tris?
Christmas, Marcus?
What did you say?
What's my Christmas gift this year?
You have to wait and see. You have to wait and see. If you're lucky, you might get a Lifty. Can we see one from the front, Tris? Can we see an angle from the front, just of the two sides, just so we can compare?
Sure. Do you want to just lean forwards a little, and we'll get a little zoom on that? Okay, so that's brilliant. What do you notice there, Marcus?
So it's interesting because you don't obviously see like, oh, Zara's had cheek filler on her right side, but what you see is a more, I think he seems more sculpted on the right hand side. And when patients say, I feel like if I have filler on my face, I'm going to look more like a hamster, more kind of full in the face. Actually, what you find here is it looks very slimming and very sculpting for Zara. It looks really good from what I can see here, Tris. Yeah.
Great.
That's only a very small amount of filler, isn't it?
That's correct. So now we'll just move on to the patient's left. Are you ready to go again?
Yes, thank you.
All right. 1, 2, 3. So again, this is the traditional stabilization. On this one, you're squeezing not just the needle, the chamber of the needle, but also the skin at the same time. So you've got a really good grasp on the stability of your product, your syringe and the tissue. That's point 2. Turn, please. Thank you. And then we've got these 3 to do. Now, at the start of your injecting, you might want to move around from side to side. But I encourage you, if you're right-handed like I am, you might actually find it easy to stay on one side. If you turn a bit more, please, because you've actually got a much better approach reaching over to the other side. And this is how I've started to do injections now. So a little scratch. Again, well done.
That's it. I've never seen you do that before, Tris, when you've treated. I've never seen you go to the other side like that.
Yeah, it's because my arm goes in the way of the camera when I do.
Oh, fair enough, yeah. That's why we've never done it on the show. We can see it, actually, to be fair. It's a good tip, because I do, when you're treating on the patient's right-hand side, it can be quite difficult, can't it? Because you're kind of all scrunched up in yourself to try and aspirate at the same time. So, yeah, it makes sense.
For anyone worried about doing treatments after 4 weeks of not doing it, it comes back very quickly, please don't worry.
I'm sure Zara will be glad to hear that too.
Lovely. So for each of these, we're doing an aspirate. And that's a nice way to spread 1 mil across the cheekbones to get a subtle but very effective beautification for the mid-face in our younger patients. So let's take a little look at this, Marcus. If you can just sit forward again, please. Brilliant. So I'm really happy with that. I'm sure you can see that in the mirror as well.
Yeah, looks good.
Excellent. So now let's focus on the chin. So in the chin, we want to use a more elastic product, something with a bit more projection capability. We're moving to Juvederm Volux. And we're going to demonstrate the chin treatment with needle. And for that, it's just going to be 3 injections, 1 in the midline and then either side. And that's all we need. I don't think we'll need even half a mil to achieve what I need to achieve with this.
It's worth noting that Volux is quite a bit more volumizing than Voluma. So if you were using Voluma, I don't think you get a lot of chin result for under half a mil. Is that fair to say?
Definitely, yeah, definitely.
But yeah, with Volux, you can do a chin augmentation with 1 syringe, depending on the person.
Yeah, no, I'd agree with that. I mean, I find, to be honest, using Voluma now in the chin, I can't really even see where it's gone. You know, it doesn't. You don't feel like it does anything, do you? When you have a little bit left, you use it in the chin. It's not enough really. When you've used Volux as a comparison, it's nowhere near.
Okay, so as you were saying, Marcus, like when we assess the chin, obviously we want to make sure that the anterior, the first thing that your finger touches when you touch the chin or will touch your own chin, is called the soft tissue pogonion. And the projection of this pogonion should be in line with the start of the nose. And that vertical plane is called the frontal plane. And you can see in Zara that actually creating more anterior projection isn't appropriate. We don't want to do that. I did an assessment earlier and it over projects the chin. So my focus is not on the front. We don't want to create forwards projection. We actually want to create downwards and anterior projection. And so this is where I'm going to focus my 2 boluses. Slightly towards me, please.
Yeah, before that, Trish, do you think we can get Zara from the side? Because you see on the camera what you're talking about. If Zara, you can look right over to one side, and if Josh can just pan over, it'd be quite nice to be able to see that.
Sure.
Yeah, absolutely. You can see there just like that.
Perfect, thank you there.
Yeah.
And then up a little so we can see the top of the, sorry, not you, the cameraman. Up a little so we can see the top of the eyelashes.
Beautiful.
Perfect.
So yeah, so we call this the nasion, the start of the nose. And you can just see if we create undue anterior projection, we start to become over projected. And so really, I just want to soften the base of the chin, this is the menton and the nasion, and just create a more continuous feminine roundedness to the chin, which balances with the width of the nose, which is where my focus is going to be. So head back, please.
Perfect, thanks
So
for
how are
that.
we going to do that? Chin up, please. We're going to start over with a superperiosteal bolus just here. We're going to do 0.15. 1, 2, 3. Perfect. Find bone. Aspirate.
It's exactly the same technique as the cheek treatment.
Then with your non-dominant hand, you can squeeze and you can find the filler. You can make sure it goes where you want it to. And you can see it's created projection, just where I wanted it to go. Let's do the same here.
Tristan, how often would you combine this with mentalis toxin, if at all? Because often, like contraction often contributes to that flattening that you're talking about.
Absolutely right. I think it's an age-related thing. For me, if that upwards rotation is because of volume loss, I would start primarily with filler and see where we get to. But if the significant contraction was just purely because of the morphology and because of the muscle contractility, I think that's a good opportunity to go in straight with Botox as well. What about you? Similar?
To me, it comes more down to a convenience thing. In as much as mentalis toxin is great, but it doesn't last that long, I find, because you have to use quite a low dose. So if I'm doing someone's Botox treatment anyway, I might do that at the same time. But if they are having a lower face treatment, I would more likely to use filler because of the longevity of the result.
Interesting.
I wouldn't really have someone come back to me 3 times a year just to get mentalis toxin.
No,
No, absolutely. I don't think people are prepared to pay for that, are they? Just for a bit of
No,
Botox.
that's the other thing. It's not really a standalone treatment,
No.
but it's very good complementary addition.
I think it's a little bit left in the syringe when you've done their Botox. Often that's kind of the place it goes, really, isn't it? For people that have that kind of crease. For me, it's like, oh, and often that's a really nice thing to introduce people to the idea of lower face treatments. I find when I've done their forehead and there is like, about the lower face as he ages, starts to properly rotate. Let's put a little bit of Botox in, see how you get on over the next couple of weeks. And often that leaves them thinking this could actually be something that maybe I will look into a bit further.
Yeah.
Perfect. So that's it, Marcus. We've just softened the chin there slightly, so I'm going to ask you to sit forward. And then we can take a look at the overall shape. Now, this is subtle, of course, but what I think hopefully you can see is that we have more lateralization in the mid-face, creating just this more highly sculpted appearance. And then as the shape of the face transitions towards the lower third, we've got a softer, more balanced chin in relation to her very slight nose. What do you think?
I love it.
You see it? Okay, fantastic.
No, you can definitely see it on the camera, Tris. It's a really, really nice result. It just is, like I said, it's very complimentary, and it certainly doesn't look like he's always had any filler at all, but it just enhances and sculpts those key areas and gives that really nice contour down into the chin now, which looks really good.
Yeah. And then just to touch on the thing Zara was talking with me earlier about her under eyes and her under eyes being a concern. And this is probably something we can debate, guys, which is, we have started a touch of volume loss in the front of the cheek, but it's hardly completely lost its volume. There's definitely still a good amount of volume there, and that's contributing to the slow descent of the orbicularis ligament, and then the show of the exposed bone and the muscle there, and you can start to see some of the tear trough showing. And the question is, do we treat now, or do we treat when it's, what I said was more ripe? What do you think?
Let me have a close look at you if you don't mind, Sarah. I would not treat now because I think it's extremely subtle. It's not unattractive. It's not aging. And the risks benefit ratio isn't good enough for me to feel happy. That's what I would personally do. I'm not your doctor today, Tristan is. So.
Well, I think I said the same thing. So I think that's certainly nothing to.
Also, the under eyes, it's one of those things that people subjectively, it always looks more noticeable to the person involved than it does more objectively, because it's where they look when they're looking in the mirror. And generally speaking, it's one of the areas that is easy to overdo. The areas we've treated today are not easy to overdo. Probably could have had a bit more filler and it still would have looked lovely and natural, but the under eye is easy to overdo. So I would err on the side of waiting.
Marcus?
Sorry.
Yeah, no, brilliant. I agree with you both. I don't think at this stage so I'll need it at all, but I think it's the next area, let's say, is something you could address. But I think in this context, it's nice to keep things looking natural, and you still want to have those natural shapes in your face. And I think doing filler everywhere at the maximum amount isn't always the best option for your patient. So for me, I think that was a really nice treatment, a really nice result overall. So brilliant to have Zara on the show tonight, and a really, really nice result that Tris did there. So that's getting to the end of our show now. I just want to remind you, we're going to be doing an after show special on every single episode we do, which basically means that after the show, you can go on Instagram, go on our Instagram stories at Harley_Academy, which is our Instagram name, and you can basically ask any questions you want around the show. We'll answer them throughout the week before next show starts. If you haven't already, please remember to click subscribe, and I'll hand over to Tris, who's going to wrap things up tonight, and say bye, and I'll speak to you soon.
Thanks, Marcus. So I hope you enjoyed the demo this evening. Straightforward treatments, but with a bit more focus on the actual technique, and particularly sharing how we handle the syringe to maximize our ability to get the best outcomes and to be as safe as we can. So we'll be back next time with another treatment. Thanks for watching. Goodbye.